Good morning, everyone. I'm Cameron Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba. Bonjour à tous. C'est un plaisir d'être ici avec vous et pour vous donner une annonce importante pour tous les Manitobains et pour vous mettre à jour. I want to begin by acknowledging that this week is Mental Health Awareness Week. Our government is pleased to be the first province that is offering Ability CBT, a free virtual therapy program to respond to increased anxiety due to COVID-19. As of this morning, I can report that over 1,800 people have already accessed these services, including all Manitobans eligible over 16 years old. We're also proud to have partnered with the Manitoba Schizophrenia Society on a peer-to-peer connections program that is happening both in Winnipeg and in Dauphin. Last year, many Manitobans will remember that we announced a $4.2 million investment at Health Sciences Centre, Winnipeg, that allows for children and youth to receive better assessments and treatment and also resources for their families as well. Mental health matters, especially during COVID-19. I want to again just express gratitude to all of Manitoba's healthcare workers who continue to be on the front lines every day. We thank them for their unwavering commitment to their patients and to the principle of keeping Manitobans healthy and safe. They have been there, in and out, day by day. Doctors, nurses, social workers, maintenance workers, facilities workers, pharmacists. We thank them all for the sacrifices that they are making during this exceptionally challenging time here in Manitoba and right around the world. Throughout the COVID-19 pandemic, our government has said that we place a focus on the health and safety of Manitobans. Manitobans will know that exactly 1 week ago today, we placed into effect a restriction that would ensure that a personal care home worker is only working in one facility. I can say that that is now in effect in all of our 127 long-term care facilities in Manitoba. Congratulations to everyone for making that happen. We have continued to expand our testing criteria in Manitoba. Now any Manitoban who has any symptoms is eligible to be tested for COVID-19, and we can expect that our testing criteria will continue to expand. Manitobans will remember that we were one of the first to introduce new fees for virtual visits, so people could see their doctor in a virtual way by telephone or video link without actually going to see their doctor in a clinic. This has been helpful for helping people during a global pandemic still get the health care they need, and we expanded that list and added 4 new important virtual charges, including one that allows a doctor to give care to a resident of a personal care home without actually physically seeing them. And that keeps safe, of course, the resident in the personal care home, who's among that most vulnerable group that we want to protect, and it also keeps our healthcare providers safe. And of course, we have introduced measures to safeguard the supply of medications for Manitobans. So we knew that early in the new year, concerns began to be heard about the global drug supply, manufacturing, shipping, global supply chains, all under scrutiny. In March, all provinces and territories accepted a recommendation from the Canadian Pharmacists Association and the Canadian Association for Pharmaceutical Distributors and Management to limit prescriptions. It was done to minimize potential shortages, to prevent people from stockpiling medication. Many people will remember there were some messages at that time from the federal government indicating that people should stock up, but that can have a negative effect as well. And another contributing factor was the fact that because March is the end of Manitoba's pharmacare program year, some people choose to stock up in the month of March. So for all those reasons, we acted, as all provinces and territories did, to restrict prescription renewals to a 1-month supply. And while that decision that we made was necessary, it had an impact on Manitobans, and we have been monitoring very carefully the impact that this has had on certain Manitobans. It has not been easy for all Manitobans to have to pay, in some cases, triple the dispensing fee for the same supply of drugs, because now they were getting them filled, restricted to a 30-day supply. And it wasn't easy when at the same time we continued to tell people that they should stay home, they should isolate themselves, and avoid going to public places as much as possible. I would also add that it was not easy exactly at a time when so many Manitoba households saw a significant interruption in their ability to earn income, and that effect is very real in many households today. This is why our government did take action early and enacted measures to take some of that burden off of Manitobans. We announced shortly after that policy was launched that we were freezing the pharmacare levels, the rates, at last year's level. That means that no user would see an increase to their pharmacare plan rates effective for this 2020-2021 year. We also committed, of course, to continue to monitor the drug supply in Manitoba, in Canada, and around the world. And I can report today that the situation has changed a lot since that date in March when we brought these changes. This Monday, you will remember that our province began that first phase of easing restrictions to start to support the work of economic recovery. Also Monday, we began to restore health services that many Manitobans have been waiting for: surgeries, tests, diagnostics, procedures, and some therapeutic services as well. And in the same way, we've been monitoring the situation. We've been doing the same when it comes to our concerns around global production and supply of drugs. And at this time, the evidence is pointing to the fact that the situation is stabilizing. We have a better understanding now of the drug supply in Manitoba, in Canada, and around the world. We know that some manufacturers in China who had ceased or slowed production have come back online. And we know that, that the global distribution issue has proven to be more intact than was previously expected. And so, as a result, today I am pleased to announce that our government will be, effective Monday, removing the 1-month limit on prescription renewals. Manitobans who have prescriptions will be able to fill them as per their prescriber's directions, including up to a 3-month supply, as long as the drug is not affected by a shortage at the time of the fill. Et les Manitobans qui ont des ordonnances pourront les remplir conformément aux instructions de leur prescripteur, y compris jusqu'à 3 mois de médicaments, tant que le médicament n'est pas affecté par une pénurie au moment de réplissage. We are making this evidence-based decision now that we understand the global and domestic drug shortage is more stable. Manitoba Health Seniors and Active Living is working cooperatively with pharmacists in Manitoba to convey notification of these changes, to provide necessary information, and to support them as we shift back to prescribing practices that we saw before COVID-19. This is not to say that we're dismissing out of hand concerns about drug supply and drug shortages. Rather, we're shifting to an evidence-based approach. Health Canada continues to monitor and list drugs that are known to be in short supply. They can be found on a federal government website at drugshortagescanada.ca. Starting Monday, it will be this list of known drug shortages that will inform decisions on which drugs remain limited to a 1-month fill in Manitoba. This is a balancing act. It's a balance between fairness and evidence-based decision-making and acting to safeguard drug supply. I'm also announcing today the immediate establishment of a time-limited COVID-19 drug shortages working group. J'annonce également aujourd'hui la création immédiate d'un groupe de travail COVID-19 à durée limitée sur les pénuries de médicaments. This working group will be responsible for ongoing surveillance and monitoring of drug shortages and drug availability in the province, and they'll also monitor supplies throughout the country. They will look to create solutions to ongoing drug shortages that are also unique to Manitoba. And the group will also solicit proposals and input from industry, from stakeholder groups, and from health-related associations to make evidence-based decisions about what comes next. And this group will include officials from Manitoba Health Seniors and Active Living, as well as representatives from Pharmacists Manitoba and the College of Pharmacists of Manitoba. Before I end, I want to remind all Manitobans that if you've experienced a significant change in your income, as we know many people have because of COVID-19, you can have your pharmacare deductible reviewed. Pharmacare deductibles are determined based on an income that you declare in your tax information from 2 years prior to the current fiscal year. Individuals are able to estimate a revised income for the current year, which then results in a new deductible. And once the income taxes are filed the next year, that projected income is compared to actual income, and that difference is reconciled. So to have your pharmacare deductible reviewed, if you think this applies to you, you can call toll-free 1-800-297-8099, or you can email pharmacare@gov.mb.ca. Going forward, our government will continue to make evidence-based decisions to ease public health measures as we reintroduce services. It's all part of our commitment to you as Manitobans, a commitment to protect the health and safety of Manitobans. We're pleased to make this announcement today on the basis that we believe it will benefit all Manitobans. And in closing, we just want to say thank you. Thank you for staying the course. Thank you for continuing to comply with the public health orders. Thank you for your efforts in helping us flatten the curve here in Manitoba.
Thank you, Minister. A reminder to the reporters online, you will have one primary question and one follow-up question. Up first this morning from CJOB, Diana.
Good morning, Mr. Friesen. It is Diana from 680 CJOB. What have you learned from the pandemic in general and the response that you can kind of apply to the ongoing reorganization and restructuring of the province's healthcare system? What's kind of worked and what hasn't?
It's a good question. We've been doing a lot of learning. We often say among key leaders, and we have such a good group of key leaders at our incident command structure. We thank them very much for their tireless efforts. Certainly Dr. Brent Rusin and Lynette Saragusa, the chief nurse at Shared Health, but also the teams that support them for their excellent work during this time. We say among us as leaders that we have learned during this time how important it is to have good linkages within our healthcare system. Because really we need that. We cannot operate where regions are separate entities, but that they need to be linked. Department needs to be linked, shared health needs to be linked, and the other health authorities like cancer care need to be linked in. So we've learned how to work fast, we've learned how to solve problems, we've learned how to fail quickly, and then to go on to new things. I think that learning will continue, but I would say this. We know that a lot of this is reinforcing what we've said about the changes we've been making in this province, our provincial clinical and preventative services plan, the reorganization of our healthcare system. We've benefited from some of the changes that were taken a year and 2 years ago.
And just as a follow-up, it sounds like one of the things that is going quite well at this time is virtual visits for doctors. How might the province take what's going well there and kind of keep that going in the future post-pandemic?
So this was always part of our comprehensive plan that we knew that we needed to modernize the way people are able to seek health care in the province of Manitoba. We were pleased, along with Doctors Manitoba, to be able to be one of the first provinces to bring those virtual visits. And I would say this today, we remain engaged with Doctors Manitoba. There is a working group that has been established on a go-forward basis that will continue to take these issues forward. It's a collaborative group with participatory membership, and we're going to be able to weigh the value of things like these virtual visits on a go-forward basis, not just restricted to a global pandemic, But maybe in future we'll see more of this. I've talked to so many Manitobans who have told me they or their family members have already sought an appointment online, and they've said to me, we hope we don't have to go back. Now, we get it. In some cases, it's necessary to go back. But I think appropriately, in the places and times it makes sense, there's more that we can do to facilitate changes that will allow people to get their health care in modern ways.
From the Winnipeg Sun, Glenn.
Yes, Mr. Minister, Glenn Dawkins from the Winnipeg Sun. Any concerns with the lifting of the 1 month limit that it may now prompt shortages? It sounds like you're confident there's plenty of drugs in the supply, but any concerns in that regard?
Well, certainly I would say that we remain concerned about global drug supply. However, as I said, the system has, or the situation has changed since March 19th, that date when we brought these changes. We see more stability in global production. We see more stability in global distribution. We see supply chains broadly not disrupted as much as previously thought. And we even see domestically that when it comes to distribution, there seems to be more confidence. There are areas of concern, and that federal website lists some of those. So I think that our efforts are collaborative. We will continue to study this, and we will rely on the work of this new working group to continue to feed back the information and advice about where we need to release measures and where we might have to add measures. So this is very much a balancing act, and we believe we're trying to get it right.
I'm curious. Now, it comes into effect on Monday, May 11th. Why the delay in terms of why can't it be immediately effective?
Thanks for the question. It's simply to allow pharmacists to be able to make the changes they need to make for the Department of Health and the Director of Pharmacare Program in Manitoba to be able to distribute information and convey information. It just gives a time period in which that adaptation can be made. We did this in cooperation with Pharmacists Manitoba.
From CBC Radio Canada, Laisa. Thank you. From CBC Manitoba, Peggy.
Good morning, Minister Friesen. So my question is, can you tell us a little bit more about how drug supplies will be monitored in Manitoba? And like how would the working group keep an eye out for that?
Right. So as I said, this working group will have the responsibility to engage with the federal government, Health Canada, on that list that has been prepared of known drug shortages. But they'll do more than that. They're going to receive proposals and statements from other groups. So industry groups, remember, there's a lot of groups, some headquartered here in Manitoba, that have drug insurance plans. We need to talk with those people. We need to talk with health-related associations and other actors, distribution agencies, to know what's going on. This is a very dynamic situation, so we need good information. We need up-to-date information, and this group is prepared to take up that challenge. I would suggest also that we've seen similar types of approaches already appearing in other provinces. Oh, and let me just correct the record. In my previous response, I said we undertook that action in cooperation with Pharmacists Manitoba. I mean pharmacists in Manitoba.
Okay, and if, for example, in a few weeks, if shortages were to occur again, what measures would be taken then? Would the 30-day supply limit be reinforced?
Well, what I would say is that because we're taking a drug-by-drug specific approach, what you may see is notifications or updates given that certain other drugs will be restricted. Right now, we're seeing some drugs in shorter supply for people who have COPD or respiratory illnesses. We see some drugs that are necessary if you're on a ventilator or you're in an ICU. Some of those drugs are in shorter supply, so that supply needs to be safeguarded. What I would say going forward is specific drugs, as the evidence shows they may be in short supply, those drugs would be restricted.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Mr. Friesen, I just want to be clear. On Monday, everything will go back to 90-day limits, subject to further restrictions from individual doctors and prescriptions. And then, so nothing will be limited to 30 days by government on that date, but the working group might impose a 30-day limit on specific drugs later. Is that correct?
Well, just to be clear, first of all, this does not mean that every prescription fill now happens at a 90-day level, because we weren't only filling 90-day scripts before COVID-19. In our system, the ability exists for a client to have up to a 90-day limit. That depends on the prescriber, it depends on the client, it depends on the medically specific situation, it depends also on the pharmacist. So this, of course, is saying today that we are releasing that 30-day limit that we had imposed. You can now receive a prescription up to a 90-day script, but immediately we have in place certain drugs that are restricted, and the federal government has flagged which ones those are, and the working group will come up to speed with that information, but then also be dynamically making recommendations based on ongoing dialogue and collaboration with other jurisdictions and stakeholders about what we might also need to restrict, or what drugs now could be released because we have more confidence on their availability.
Okay, my follow-up is, you're very well aware that people were complaining about paying triple the dispensing fees, as you mentioned. Is there some way that the province, or is the province considering prorating dispensing fees so that people are not paying the same dispensing fee for a 30-day supply that they would for a 90-day supply?
So we're not looking here to blow up the way the fees work for prescribing. That level of disruption we don't think is warranted in this case. Look, the decision we made in March was a decision made by every province and territory in this country. It was made on the basis of evidence. It was made on the basis of the advice by the federal government and by associations nationally. At this point in time, we think the time is right to release that restriction. Like I said, it's a balancing act, but clearly what Manitobans should expect come Monday is a return to more normal prescribing practices pre-COVID-19.
From CTV Winnipeg, Jeff.
Hi, Mr. Minister. Jeff Keel, CTV. Kind of following up on Steve's last question. The other day, the Premier said that your government was seriously considering waiving dispensing fees. So why just lift the restriction and not just waive dispensing fees during the pandemic and maybe keep the 30-day limit on?
I don't know, maybe something got lost in translation there. I think the Premier was quite clear that we were looking to lift the 30-day restriction that we had put into place. So certainly, I would suggest to you that during a global pandemic would not perhaps be the best time to make broad, swooping policy changes to the way we do prescribing and the fees for that. This is a limited action. Manitobans will see us return to more normal prescribing practices coming Monday.
Okay, thank you for that. And my follow-up is a question I've been asking for a while. In the phase, as we approach phase 2 of the opening plan, people are asking, when will there be some restrictions lifted on when people can visit loved ones in hospital, especially those who may be in very serious condition?
Yeah, this is an excellent question. None of this is easy for Manitobans, and the kind of disruption that Manitobans have had to endure because of COVID-19 is very significant. And one of the most significant things we've seen is that restriction that we've put in place in hospitals, in personal care homes, in other health settings that restrict the ability to limit the visits to a loved one. That is hard, and I can tell you we receive correspondence at my office to tell us how hard that is. We know that MLAs in this legislature get that same correspondence. I can tell you that this is a topic of careful discussion. We continue to look at this. We continue to look for every way in which we can balance the need to keep hospital settings safe with the need to facilitate that engagement and interaction. I mean, I could give a shout out here. Health Sciences Center Foundation and other foundations have been just so good in leading the way and providing iPads to be able to allow people to visit their loved ones virtually. I know that's not everything. We also know that in situations like a palliative setting, when an individual may be near death in a hospital, when someone is significantly impacted, or when it's a pediatric situation, acute or critical care, we have made allowances. But at this time, we'll continue to study it. We're very, very aware of the hardship that this creates. We're doing everything we can to address this.
From City News, Jonas.
Good morning, Minister Friesen. Jonas Gilbert, City News. As we head into summer, warmer temperatures on the way. I imagine a lot of Manitobans looking at interprovincial travel. How are you guys evaluating the safety of this, and is there any anticipation of lifting limits, or I guess what are the guidelines for that?
Well, it's a good question. We rely very heavily on the advice of the Chief Provincial Public Health Officer. Brent Friesen would be the first to tell you that Manitoba's situation right now is an enviable situation. I mean, with one new case and 30 active cases, and the number of people that have recovered getting near 250, that's some pretty enviable data compared to other jurisdictions. But there's a lot of this story left to write. I know there's been a lot of interest in why is the gathering level still set at 10 and under. Well, Dr. Friesen is here every day and making those updates and saying that we have to balance this out. We have to avoid a situation in which we release so fast that we overwhelm our healthcare system's ability to respond. Right now, we have capacity in the system. We must retain that capacity in the system. So I know Manitobans are anxious for things to return to normal. I would tell you some people are saying that we are moving too quickly to open up. Other people contact us and say we're not moving quickly enough. Probably the right path is somewhere in between. As Dr. Friesen likes to say, there is no textbook on how to reopen an economy following a global pandemic. We're listening, we're liaising with everyone that we need to, and we're trying to get this right.
And as we come to the end of the first week of the economy reopening, are you pleased from a public health perspective of what's been happening, that things are opening in a safe manner, people are following the regulations so far?
I won't answer for the Chief Provincial Public Health Officer. He'll be back today, and Brent can give his own reply. I will tell you as the minister, anecdotally, I'm quite pleased that Manitobans are still taking this so seriously. We have seen business and industry, nonprofit groups, the museums and libraries that are opening, really endeavoring to put things in place to get this right. I would flag to all employers that we have a very significant summer student program that we have launched. You're going to need to come to a different level of compliance in your workplace, cleaning things, demarcating lanes that people can walk in. This is a great chance to hire a student. We're helping you to do that with a rebate to get on with that work. But so far, I would say, so far, so good. Manitoba's story is essentially reflecting on the fact that we have done the right things. We've self-isolated, we have maintained distance, we've coughed into our sleeve, we've washed our hands, we've stayed home. And now we say stay safe. As you continue to move around, stay safe, do the right things. That's how we write the rest of this story. We will recover, but we need to do this together.
From the Winnipeg Free Press, Carol.
Good morning, Minister Friesen. It's Carol Sanders at the Free Press. Following up on Diana's question about what's been learned during the pandemic, Nurse Siragusa has said that limiting home care workers to just one site was one of maybe the unintended positive consequences of the pandemic if that continues. Do you think that practice should continue in the future once we get past the pandemic?
Carol, could you just repeat the question? I'm having a little trouble with the audio. Thank you.
Lessons learned during the pandemic. Nurse Siragusa has said earlier that limiting home care workers to one site might be one of the unintended positive consequences of the pandemic, something that would be perhaps better for the system. Do you think that practice of limiting workers to one site will continue once we get past the pandemic?
So I think you're speaking of our move to limit personal care home workers to one site. But I would concur that we've done this in cooperation with those groups that run the personal care homes. And so in our system, we have some that are devolved and some that are non-devolved, some that are autonomous, run by faith-based or nonprofit or for-profit providers. And together we have collaborated to create this system which we've temporarily restricted. I would say this: we value the respectful relationship that we have with those providers, but I'll be very interested to harness their experience from all of this and to test the extent to which there might not be some value on a go-forward basis of limiting to some degree. I think about the potential to maybe make a difference in a typical influenza season and whether this might not help. So it comes back to the question asked previously. There could be some very important learnings that we take away from this. There will be, but not simply in terms of pandemic contingency planning, but perhaps more planning for our overall healthcare system. I would submit today that we are seeing in live time that some of the things that we described 2 years ago in health, the need for a more coordinated system, the need to clean up what the department was doing and what the regional health authorities were doing, and the need for a shared service to support the things we were all doing, that those things are right now being tested and being validated to a great extent as we move through this. So once again, thanks to everyone who's helping us to do that, and thanks to Manitobans for their work in helping us get these good results.
Okay, and my follow-up question is about PPE. Yesterday we found out that $400 million so far has been set aside as of mid-April for PPE. I'm just wondering, is that expected to carry us through to the end of this pandemic, or is that for a stockpile to prepare for future needs?
So it's both, but right now what we've done is we've done a very, very careful analysis of the inventory that we have on hand. We've done a very careful analysis of what we need to respond to the pandemic. And of course, no one has a magic wand there, but we've done a lot of heavy lifting at procurement and supply to understand burn rates, to understand how we utilize, how we store, where we store. Clearly, I would say we're planning for the pandemic. Beyond that, I think we'll have to revisit and say, what do we want to do on a go-forward basis to be able to safeguard and create capacity where perhaps in the past capacity hadn't been maintained. But I would say this as well. Look, when it comes to personal protective equipment, we need more. We're pulling out the stops. We're working in cooperation with the federal government. We have an order in, and we continue to wait very expectantly for the more supply to arrive in jurisdiction. But also, I have to give a shout out to those who are leading procurement here in the province at this time, who I would say in the past may have engaged with 50 suppliers and who are now engaging with 500 suppliers, even suppliers, new suppliers in Manitoba. A shout out to companies in Winnipeg and southern Manitoba, all across the province, who are creating and starting to create the supplies that we will need to respond to this global pandemic. Everything from visors and masks to medical gowns. We need that and more, and we'll continue to monitor very carefully our needs and liaise with the federal government to make sure that the orders that were promised are delivered.
From Global, Marnie.
Good morning, Marnie Blunt from Global News. You touched a little bit on the mental health aspect earlier on. Obviously, anxiety runs high during COVID-19 for many, but for, in particular, seniors who have had to been going to the pharmacy more frequently and standing in the lineup and are worried about their health and safety when they're being told to stay at home and they're spending more time out in public amongst people. What do you have to say to them over their stresses?
Yeah, it's true that seniors have been really affected by COVID-19. And even now, when our message is shifting from a stay home message to a stay safe message, clearly as people are able to go to libraries and they're able to shop and they're able to do some of the things that only a week ago were prevented, well, then we know the message has to become stay safe. And yet seniors continue to be impacted. You've heard Dr. Friesen continue to say if you are someone with respiratory illness, or you're elderly, or you have other underlying health issues, you may need to remain at home even at this time. And there's an impact to that. So what I would say about mental health is that we're very pleased to be the very first province to have taken up this challenge of creating an ability for Manitobans to seek services for mental health, to engage and say, look, this has affected me. I feel the impact in my mind, in the way I think, in the way I'm acting. I can feel it in my physical body. We're asking people to not sit around and wait for things to get worse. We have an ability through this Ability CBT to put people in contact with trained therapists. An unlimited number of Manitobans, 16 and older, it goes to youth as well, all the way up to elderly folks, can avail themselves of this. And as I said, 1,800 people already registered and using this. My challenge to Manitobans would be, take a moment right now, if you fall into that category of someone who feels like you're really carrying around the effect, the anxiety, and other mental health issues, pick up that phone, make the call, go to the website, get the information. People are here to help you.
Thank you for that. And just as a follow-up to previous questions, it sounds obviously the other issue is the financial aspect of paying more in dispensing fees. It sounds like you aren't looking at providing a rebate to anybody who's been paying these additional dispensing fees. Can you just talk a little bit about why that is and what's your response to people who have had the financial concerns as well?
So we are providing a rebate to all seniors in the province of Manitoba, a $200 payment that we are working hard to get out the door in a very, very quick time period. And we're doing that because, as we said, seniors have been negatively affected by COVID-19. I think that Manitobans will welcome today the news that we're immediately lifting that 1 month limit to filling a prescription effective Monday. Things will go back to a kind of a more pre-COVID-19 normal interaction between the individual and their pharmacist and their prescriber. And I believe that we've chosen the right path of balancing that need to keep the drug supply safe with the needs for Manitobans to get value and respecting the fact that we can take an evidence-based approach.
From the Brandon Sun, Drew.
Thank you. It's Drew Mason from the Brandon Sun. Mr. Friesen, you were saying now that the province has a better understanding of the global production and distribution system. Just wondering, how did the province get that better understanding?
Can you just reframe that question for me?
Sure. So you were saying a little bit earlier the province now has a better understanding of the global production and distribution system of medication and of drugs. So just wondering, how did the province get that better understanding?
Good question. Dialogue, communication, interaction with officials, interactions with the Public Health Agency of Canada, interaction with my counterparts and my officials' counterparts in other jurisdictions, work with associations, including those who distribute drugs in Canada, work with the Canadian Pharmacists Association, and work beyond our own domestic borders. So there just is a different ability to understand now. Certainly we saw with the attack in Hubei, we saw a real retraction of manufacturing and supply coming out of China. And now as things return to more normal conditions in mainland China, we've seen a lot of that supply coming back online. We were concerned about global supply chains, the ability to load things on planes and take them from airport to airport. Some of that we know now was not as significantly as affected as before, but then also the distribution chain in Canada seems quite intact. So on the basis of those things, we've made the decision, but remember, it's on the basis of the establishment of this new working group. That table will be responsible now on a go-forward basis to provide that advice to government, to say things that they might be seeing through those same interactions that would either lead us to clamp down more or to release more on the basis of evidence.
Thank you. And as a follow-up, but is the supply of drugs right now, is there any difference between the supply in the rural areas of the province compared to the more urban areas?
It's a complex question. We're learning actually more during this global pandemic about the way listed drugs move around in our jurisdiction, within Canada and within the province's own borders. What's important, of course, is that pharmacists have that ability to maintain an appropriate supply. So if you can imagine, it's a series of gates. It's the supply that enters our Canadian borders, because much of the drugs that we use are manufactured abroad. Not all of them. Some manufactured here, some manufactured right here in the province of Manitoba, but many coming into our borders. And then those gates opening to go to the province, those gates opening to be distributed to pharmacists, where pharmacists cannot maintain like a 1 week supply or thereabouts in their own supply. That will be something that will raise a flag to us, that we'll know there might be a concern there that we need to investigate.
Thank you, Minister. Thank you to everyone on the line. This concludes today's media briefing.